Good evening. I'm Mike Huckabee, and thank you for joining us tonight for a special on Obamacare. We're delighted to have you here. Now, if you are an employer, you've probably been turned every which way but loose trying to figure out Obamacare. And you're not alone in your frustration. If you're a medical provider, you're probably finding less time to practice medicine because you're spending more time, more than ever, just digging through the Obamacare legislation and all of its rules that members of Congress obviously didn't dig through, or for that matter, didn't even read. Remember when Nancy Pelosi famously and ridiculously said this?
We have to pass the bill so that you can find out what is in it.
Yeah. Well, it did pass, and the extreme court invented an excuse to keep it by calling it a tax. Now, we're starting to find out what's in it. As it turns out, it's worse than just finding a fly in your soup. It's like finding a little soup in your flies. I mean, even Democratic Senator Jay Rockefeller of West Virginia, one of the sponsors of Obamacare, this week was quoted in the Washington press in a rare moment of candor when he said this: "The law is so complicated, and if it isn't done right the first time, it's just going to get worse. Up to this point, it's just beyond comprehension." Well, we invited Senator Rockefeller to come on the program tonight. He declined, but his spokesperson gave us this statement. Senator Rockefeller was a key author of the landmark health reform law, and he is very strong in his belief that this law will do good for many millions of Americans. When the law is fully implemented in 2014, it's going to be the first time that such a sweeping health reform law goes into effect, and there will undoubtedly be some challenges. But the senator's point was to encourage the administration to get ahead of as many of those challenges as it can so that implementation goes as smoothly as possible. Well, maybe his earlier statements were more candid than they were comfortable. Or maybe he got a late-night phone call from Valerie Jarrett. Truth is, not one Democrat I can find ran on a platform of Obamacare last year, and I cannot imagine that anyone would next year. It's about as popular as being prepped for a colonoscopy. I mean, honesty about Obamacare isn't very popular either. When business owners like the founder of Papa John's Pizza or a Wendy's franchisee explain how it's going to cause prices to go up, they get savaged by left-wing activists. And when companies like Hobby Lobby seek to opt out of the provisions that would force them to pay for procedures that violate their moral and biblical principles, they get sued and even fined millions of dollars. Tonight, we're going to give you some honest and truthful answers about Obamacare in this Huckabee special. I'm worried. Maybe you wonder, am I actually worried at all that I'm going to become a target of the left? Nah, I already am. But we're going to find out just how honest and truthful the president was when he told you things like this.
The only thing reform will mean to you is your health care will cost less. If you like your doctor, you will be able to keep your doctor, period. It is a cost that will not, I repeat, will not add to our deficits.
Right. Well, no matter your age, your gender, your employment status, or your income level, Obamacare is going to have an impact on your life, your budget, and your health care. Let me put it this way. You probably can't afford Obamacare, but you for sure can't afford to miss tonight's special edition of Huckabee. All right, let me introduce you to our panel that's going to be with us throughout tonight's special. Tennessee Congresswoman Marsha Blackburn, who's on the House Subcommittee of Health Care. Also, Associate Professor of Medicine at NYU's Langone Medical Center and Fox News medical correspondent, Dr. Mark Siegel. And Betsy McCoy, former Lieutenant Governor of New York, also the author of the book, Beating Obamacare. Glad to have all of you here tonight.
Thank you.
All right, Dr. Siegel, we're going to start with you tonight because there's so many things we want to try to help our audience understand about Obamacare. President Obama, we just saw the clip, said, if you like your doctor, you can keep your doctor. Are we going to be able to keep all our doctors?
You have to ask your doctor that. That's the conversation I want you to have with your doctor, Governor, because first of all, your doctor in private practice might decide they can't afford to keep their office open, or they may cut back what they're seeing, or they may try to see more and more patients, in which case you may not get in. In Massachusetts, there was already a problem with that. There may be a delay in getting in to see the physician you want. Your physician may join a hospital. He may join a larger group. He may decide that now's the time to cut back. He may not take Medicare anymore. He may change what insurances he takes. That's the conversation you have to have now.
Let me help you avoid some of the landmines ahead.
Okay.
If you are a baby boomer, line up your doctors now, your internist, your cardiologist, even if you're healthy, because if you wait until you turn 65 and go on Medicare, you will not be able to find a doctor willing to take you on as a new patient.
And why not?
Because this law, over
That's
half of this
ObamaCare.
law, that's right, I read this law so you don't have to, Governor. Over half of this law is paid for with cuts to Medicare, and doctors are going to be paid less to take care of seniors than any other kind of patient. Also, if you're a senior, brace yourself for less care for the same reason, because of these cuts. For example, not only may you lose your doctor, but you may have trouble finding a hospital willing to take care of you. Richard Foster, the chief actuary of Medicare, who works for the president, warned that some hospitals are going to stop accepting Medicare because the payments will be so low.
And a lot of these cuts are coming because of IPAB, which is the Independent Payment Advisory Board, and that is what is going to tell your doctor and your hospital and Medicare what they can provide to seniors.
Now, this is the federal panel that says this is covered, this is not.
That is correct.
And who's on that 15 panel
board? It is
board?
whomever is chosen by the HHS secretary.
Non-practicing people, not doctors, not practicing physicians.
They're individuals that are chosen by the HHS secretary to make these determinations and decisions. And those decisions that IPAB makes are influenced by the preventive service task forces. And I invite your audience to go Google that one and see what it says about mammography and prostate cancer. But you've got these agencies who are going to tell the HHS secretary, who will tell the insurance companies what you are going to be able to have access to.
See, that was one of the fears that a lot of people had, was that you have centralized control where it's not the doctor sitting down with a patient and saying, you know what, I think I need to order you a mammogram. It's checking to see, does the federal board of bureaucracy say, yeah, I think you ought to have that.
That's the Kafka board. And I have to tell you, Governor, to Betsy's point, already 30% of new Medicare patients can't find a primary care doctor. When you load Obamacare regulations on top of it, it takes away the one thing we liked about Medicare, which was you could use it to order whatever test you need. Yeah. An elderly person has more medical problems. I've got to be free to order the tests they need.
And let's point out that even before IPAC goes into effect, Section 3000A of this law.
You know what? You're getting a lot of exercise.
Oh, right.
That's better than Obamacare. Just lifting that thing up.
Section 3000A of this law awards bonus points to the hospitals that spend the least per senior. Now think about that.
Wow.
I wouldn't take my beloved dog to the vet that spends the least per animal, but I'm supposed to take my mother to the hospital that spends the least per senior. We have a lot of evidence that the hospitals that are the lowest spenders have higher death rates. For example, if you're a senior and you've had a heart attack, you have a less chance of making it home after that heart attack if you're in one of those low-spending hospitals.
And the other component of that is there is a new readmissions policy. And that readmissions policy will penalize the hospital if within 30 days you're readmitted. And so the hospitals are going to be a little bit more judicious in how they approach that. But
I think judicious is a misleading phrase, though. It's recklessly denying care, because when you reward the hospitals that spend the least per senior, right? Mm-hmm. That means hospitals are not going to want to do the expensive procedures like a hip replacement or a knee replacement. Right. And the way they count this, it includes the 30 days after the patient is discharged. So hospitals are not going to want to prescribe that rehab you need after your knee surgery, or even that return trip to the cardiologist.
It's the patient that's going to suffer when this happens. Because a patient may go home, Governor, with something, and it may come back. They may be sick. They may have heart failure, may not go away. They may theoretically go out to the community and see a doctor there. Maybe they can't can't find a doctor there. They come back to the hospital. The hospital says, oh no, here they come again. That's not what we want. We want hospitals with open arms.
But let's help people cope with this, because they really do need tips. One of the things I say is, if you're going to the hospital, be aware that there's going to be a lot less nursing care. You're going to wait longer when you press that button for help. So if you can cobble together the money to hire a private duty nurse, at least for the first night, do it.
Well, I tell you what, it sounds like it's going to be a lot of fun sorting through Obamacare. And that's why you need to stay with us, because all this hour we're going to be helping to answer those questions just like these. And one of the most important things we hope to do for you tonight is to help you understand not the political issues of Obamacare. You've heard all that. We want to talk about how it's going to affect you. And obviously, as you can already see just in our first segment, it will affect your access, it will affect your cost, it will affect everything that touches your life in relationship to health care. Representative Blackburn's home state of Tennessee tried a plan that was similar to Obamacare, and as the Congresswoman can attest, hadn't lived up to expectations. In fact, it failed miserably. Up next, we're going to talk about what went wrong with TennCare and how it might serve as a cautionary tale of what's yet to come. Stay with us. We will be right back. In 1994, Tennessee launched TennCare. Now, like Obamacare, it promised that it would make health care more affordable as well as expand coverage for the people of Tennessee. But it turned out to be a money pit. So should TennCare be a warning sign of things to come under Obamacare? Well, maybe so. Congresswoman, you were in the Tennessee legislature when this first was introduced. You've now seen it implemented and now reformed and greatly changed. Now you're watching the country do what your home state did. Tell us what to look for.
Indeed, and every time Secretary Sebelius came before us during the Obamacare debate, I would say, tell me what your lessons learned are from TennCare, because we knew that the program quadrupled in cost within 5 years. The legislative body in Tennessee, the General Assembly, could not reconfigure it because it was a partnership between CMS and
CMS is the Medicaid overseer
Center for
at the
Medicare
federal.
and Medicaid Services. They oversee it at
all
the
the
federal.
initials we
That's
clear
right.
up.
And then between the Office of the Governor and the state of Tennessee, and it was done under an 1115 waiver. Now, here was the thing. It quadruples in cost within 5 years. You've incentivized use. Everybody has their card. They have access to the queue, but back to the first point, they couldn't get to the doctor. And so they were having to wait. You were having to drive hours to get to a pediatric dentist or to a specialist. And when people cannot get access to the care, they become very frustrated. We also saw with our providers and with our hospitals, I had in my state Senate district people that were getting 26 cents on the dollar of care delivered. Not what was billed, but of care delivered. So indeed, Governor Bredesen came in and the mid-2000s reformed the program because it had grown to be 35.3% of the state budget.
Good heavens.
You saw it up close.
Yeah, I
you
was
were right
very
next
familiar
door.
with
You saw the 4-year fight that I led against imposition of a state income tax in Tennessee, which was being put in place because something had to pay for this because the state could not afford it.
I want to give credit to Governor Bredesen. He was a Democratic governor, but a very able administrator.
Absolutely.
And you have to say that it was a courageous battle, but he
Yes.
had to wrestle this thing to the ground.
Yeah.
Betsy, one of the concerns I have is when this was all being talked about, and I'm not going to disparage the motives of the people who originally thought Obamacare would be great because, we have a lot of uncovered people, etc. But nobody was looking to states, and there were really 3, Tennessee, Massachusetts, and to some degree Hawaii, all of whom had experience. Historically, it was the states who tried something, and if it worked, we did it. If it didn't work, we learned from it. Why didn't we learn anything from watching what happened in Tennessee, or for that matter,
Massachusetts? You're quite right. Of course, members of Congress didn't even read this bill. What we really need is a 20-page bill in plain, honest English. Am I right? Yes. Yeah. A 20-page bill in plain, honest English that members of Congress will read before they vote on it. Instead, Congress repeated the mistakes of the states that have the most expensive health care, like New York, where we are today. And the fact is that Congress has now passed a law that requires everybody to buy a one-size-fits-all health insurance plan that covers many things plans didn't cover before. It's like passing a law that the only car you're allowed to buy is a fully loaded Cadillac. Some people can only afford a Honda, and that's why the prices are going to be so high.
Dr.
Governor, to Betsy's exact point, health insurance really started in the 60s when we doctors said, well, we can't get everything we want because patients won't pay for it. It has now gone crazy, even before Obamacare, where it's way too comprehensive. And now Obamacare expands it. So instead of looking at the problem, Medicaid, you can clog the turnstiles with Medicaid, and then the people who are really sick can't get seen. And the problem with Obamacare is it makes that problem worse. It gives it to more and more people, and at the state exchanges, you have Cadillac plans, you have bronze plans, gold plans, platinum plans. Well, they're aptly described because they cover too much, and that's very expensive. But if you have all these bells and whistles, you're going to get in the way of someone who's really sick.
And the unfairness of it, a couple that is planning on not having any more children has to pay for maternity care. A straight arrow who would never think of taking drugs has to pay for inpatient heroin abuse treatment.
You mean most 65-year-old women don't need maternity care?
No, but you know what? Until they reach 65, they're going to have to pay for it.
Well, you know, here's the problem, and I think that we'll continue to get into in the course of our special tonight. This one-size-fits-all that all of our panelists have talked about, it's the equivalent of going into a store just to get a simple snack of some peanuts and maybe a soft drink. Under 16 ounces if in New York City, of course. But you just want a snack, and you go in and they say, I'm sorry, we can't deliver you a snack. You have to buy the ribeye dinner with all the trimmings. You have to have a salad, soup, and you have to have dessert. That's the way. That's the only way we sell it. And that's, in essence, the way we're doing health care. And when we return, we're going to get back into this because I think it's so very important that you understand why that by its nature, Obamacare is going to be more expensive than you ever dreamed, and certainly than was ever promised. Now, while a handful of Republican governors who initially spoke out against Obamacare are now accepting the plan's Medicaid expansion and insurance exchanges, Texas, well, they're one of the states refusing to accept the funds. Coming up, I'm going to ask Texas Attorney General Greg Abbott how states can avoid caving in to what is unbelievable pressure. That's next. We are back with our panel. We're talking about the heavy cost of Obamacare. Now, on Wednesday, the Department of Health and Human Services fessed up, saying that the cost to help states set up the insurance exchanges under Obamacare are going to be double. That's right, double the estimated $2 billion. The cost actually will come in at $4.4 billion for 2012 and 2013, and the bill will reach $5.7 billion in 2014. Now, the exchanges were set up so small businesses and individuals not covered by their employers could compare and shop for plans. One of the states that declined the exchanges is Texas. Earlier, I spoke to the state's Attorney General Greg Abbott to ask him why. All right, Greg, Texas is one of the 26 states that has not joined in with the exchange program and doesn't plan to expand Medicaid. Why not?
On the exchanges, what the federal government really wanted the states to do was to be federal subcontractors with us picking up the tab for doing their work. As we've seen just this last week, Sebelius came out and said that the cost of operating these exchanges is going to more than double in price. This is going to be a very costly operation. It's going to be an operation that now the federal government is going to have to pick up. And frankly, because of the challenges at implementing these exchanges across the entire United States of America, Governor, this is going to be just one of the reasons why I think Obamacare is ultimately going to implode. Your other question was about Medicaid expansion. Let me explain what we're not doing the Medicaid expansion here in the state of Texas, and that is because the United States Supreme Court in the Obamacare decision came out and specifically said that this was the Hotel California situation. States can check into the system, but once you check in, you cannot check out. If we check into this system where the federal government is going to reimburse the states at the rate of 100% for 2 years, then ratchet down to 90%, Governor, we would be entering into a contractual agreement with a party on the other side that is $16 trillion in debt. they will not be able to continue to reimburse the states at that rate. They will continue to ratchet down the reimbursement of the states, meaning that the state of Texas and all the other states that were to opt into this system would be picking up even greater percentages of the tabs of the bill, cutting into our ability to provide things like education, transportation, the other kinds of things that states are supposed to be providing.
Well, there's been so much talk about how much pressure states are under. I've talked to some governors and attorney generals from around the country, and I mean, they're under a lot of just squeeze from providers, from hospitals, from other medical practitioners who want all of this federal money coming in. Have you guys felt squeezed in Texas? Are there people putting the pressure on you and saying, hey, this is free money, we've got to take advantage of it?
Governor, I really believe that people are recognizing two or three different things. One, they're recognizing, as we're learning more details about how Obamacare really works, they're seeing the magnitude of the problems with the system and how Obamacare really may not work at all. Another thing we're seeing, Governor, and that is the health care providers, the doctors who are being called upon to provide the care under the Obamacare program, under the Medicaid system, they themselves are opting out of providing health care under the system because they're losing money on patients and they can't make out of in volume just because they treat more patients, and losing money on each patient doesn't mean they can treat more people. And so what we're finding is that under Obamacare, there will be less access to health care, not more access to health care. And so people are quickly coming under the recognition that really the state of Texas idea is the superior idea, and that is for the federal government to provide a block grants to state so the states can best create a program that will be truly effective for both the patients here in the state as well as the health care providers here in the state.
We appreciate your perspective. Attorney General Greg Abbott of Texas, great to have you here with us today.
Thank you, Governor. Always my pleasure.
All right, let's get back to our panel. Betsy McCoy, Texas is one of the states that's saying no can do.
Well, let's explain to the viewers what an exchange is, because so many millions of people are going to end up on that exchange if they lose their on-the-job coverage, which many will. An exchange is like a supermarket that only sells cereal, or a car dealership that only sells four-door sedans. No hatchbacks, no convertibles. The only thing this exchange sells is the one-size-fits-all, government-designed insurance package. The assumption is that we are not smart enough to choose the kind of health insurance we want. And when you hear those labels, bronze, silver, gold, and platinum, it's not the jewelry store. It's all the same essential benefit package, only the co-pays and deductibles are different.
And
so
now,
don't be bamboozled by those words.
And now what they're going to do is hire navigators. HHS is going to put navigators in place, so you don't want to talk to your insurance agent, they say. You want to go talk to a government-paid union member navigator who's going to be paid $28 to $40 an hour to tell you which insurance policy you need from their government-run exchange.
I think you can see that there are many, many points of Obamacare that are very, very challenging. But let's talk about what happens in business. Obamacare requires business owners with 50 or more employees to cover workers who log more than 30 hours a week. Now, many bosses say, well, they're going to just cut the hours, or they'll have to pass the cost on to the consumers. Coming up, we're going to talk to a business owner about the challenges that she faces under Obamacare. Stay with us. Tomorrow night, 9 p.m. Eastern, be sure and watch a Fox News reporting special, Your Secret's Out. All the data being collected on you, and also how it threatens your liberty and privacy. Fox News investigates a secretive government spy center that whistleblowers fear is a turnkey totalitarian state. Also, how President Obama deployed a data mining operation to gain an electoral advantage over Mitt Romney. John Roberts hosts Your Secret's Out. That's Sunday night, 9 p.m. Eastern, right after an all-new Huckabee. All right, we're back with our panel, Betsy McCoy, Dr. Mark Siegel, Congresswoman Marsha Blackburn. You know, starting next year, Obamacare is going to force employers of companies with more than 50 employees to provide medical insurance for those who work at least 30 hours a week. Or if they don't, they're going to pay a fine of at least $2,000 per worker. In anticipation of the changes, a Wendy's franchise owner in Nebraska and a Taco Bell franchise owner in Oklahoma have told their workers expect their hours to be reduced. Meanwhile, the company that runs Olive Garden and Red Lobster, they've considered not offering full-time positions. And the founder of Papa John's Pizza has voiced concerns over the mandate. Gina Martin is the owner of Little Rock Tours. It's a bus company that, depending on the season, could employ more than 50 drivers, but has less than 50 at other times. Gina joins us now from Little Rock. Gina, it's great to see you, and thanks for joining us today.
And it's great to be with you, Governor.
Tell me some of the challenges that you face because of the seasonal nature of your business. Sometimes you're over 50, sometimes you're under 50 employees. How do you, let me use the term, navigate all of that?
Good word. Well, that's what's very challenging about what we are going through at Little Rock Tours, in that we have a very unique industry, not just for the motor coach industry, but I think transportation industries in general, because when our drivers are out on the road, you have to keep in mind that they spend the night. They're at hotels. They'll go off with a group for a week and spend 7 days in a hotel room. Well, we pay them by the day because they're away from home. So their part-time hours add up very quickly when they're on the road, and we're trying to figure out the full-time equivalency and whether or not we will have to require the health care with our employees or not. Because currently, I checked our last payroll, and if you add up the total number of hours and you add it to our full-time staff, which is, I believe, how this legislation is written, we come up with 47 full-time employees, which under the legislation, it would not affect us. However, next week, we might have a great week. Our buses may be running out a little bit longer. And in the real world, that's a good thing, unless if we exceed the 50-hour full-time employee mandate. And then at that point, we would have to be required to provide the health insurance. And we understand that this all adds up at the end of the year, and there are a certain number of weeks and a certain number of hours, 30 hours per week for full-time equivalents. However, in the end, we don't know at the end of the year whether or not we will exceed that or if we will stay under that. So we're not sure what is going to happen.
You know, and I have to just surmise that you don't know what the effect would be, but if you end up having to put health insurance on all those employees, something you weren't budgeted to do, you're talking about actually maybe not just tens of thousands, hundreds of thousands of dollars. Hundreds of thousands of dollars.
You're absolutely right. You're absolutely right. And it's very challenging to project that, especially because of the number of variable employees we have. And you add that up with the unpredictability of diesel fuel and all of the other regulations that the transportation industry is enduring, and it spells disaster for a lot of folks. And I know a lot of folks in our industry and a lot of our industry colleagues said that the ObamaCare legislation was the nail in the coffin, and it just wasn't worth it for them anymore because it's so unpredictable.
I'd like to ask her a question, Gina. I'm not going to ask you if the governor has ever been on one of these tour buses. But
I have.
I want to ask you, if you had more flexibility than this law is giving you, instead of you have to pay 60% of the value of the policy, you don't have a lot of room for deductibles, if you could create a more creative solution, and the law we feel is overly restricting you, would you be able to then have the freedom to have your employees on your policies and continue as you have done it in the past? Isn't it the restrictions that are the problem?
It is the restrictions that are the problem, and it's also the arithmetic that's involved, because towards the end of the year, we're going to have to do a lot of math to figure out what if we're going to be penalized or not. And currently, we do offer health insurance to all of our staff members who want it. But the thing is, it's so expensive for a lot of these drivers who are retired and they drive for fun. But in the end, we're going to have to do the math to see if we equal that full-time equivalent. And as you said, yeah, there's no flexibility, because not only do we have to look at all of that, but we also have to do the affordability test and to see that if the plan that we offer passes the affordability test, which that our employee cannot pay more than 9% of his income. And we don't even know what their income is, because by the end of the year, that is determined by the amount of bookings that we do.
I've got a question for
Gina,
if I can. Gina, how much, this is Marsha Blackburn, how much has your insurance gone up since the Obamacare law passed? Over the past couple of years, what % increase have you seen in the health insurance you're offering your employees?
Well, I know that for our specific plan, for our family, it went up 42%.
42%.
And across the board.
Yeah.
Yes, it did. And I just talked to our agent yesterday.
Yeah, and see, the thing is, for Gina and what she's saying there, Governor, what we're finding out from our people that we're surveying, the employers we're surveying, this year it's gone up somewhere between 26 and 132%. That is pretty much what we are seeing, and the expectation is that next year it is going to go up another 40% on average.
Well, we've got to take a break. Gina, thank you very much for joining us. I think you just remind us of how complicated this is for somebody who just wants to run a business, doesn't want to have to hire 20 accountants to help figure out how to make Obamacare work. Thank you so much, Gina, for being here. Well, insurance providers say that premiums under Obamacare are about to skyrocket. Coming up next, will you be able to afford the Affordable Care Act? Stay with us. When Barack Obama was running for president, he promised to cut insurance premiums for families by $2,500. Not only are premiums not going down, health insurance companies are warning that premiums for some are doubling under Obamacare. All right, back to our panel. Congresswoman, we were given all of this promise, $2,500 reductions. It's going to cost less because more people into the system. So where was the big disconnect here?
Well, a difference in what you say and what you do is the disconnect. And what we have learned is, yes, you're going to pay more and get less. Insurance premiums have already gone up $3,000 per family since the law was passed. And just as Gina told us, they're up 40%. They're probably going to see another 40% next year. So the escalation rate just seems to be coming at us faster than people can keep up with. The other thing is all the taxes. You've got $165 billion in new taxes and fees embodied in that law.
And most people never knew about the new taxes.
That's right.
That was something really untold. Betsy, what should we be doing? Let's talk about what should we do in order to make these costs go down and make it more accessible?
I am so glad you asked, because there are ways to help the uninsured without allowing the government to grab control of our medical care. For example, we could copy some of the best things that have already worked. All across this country, we issue debit cards to families that need help paying for food. We could do the same thing, healthcare debit cards, to allow the uninsured to buy a private health plan, to pay copays and deductibles, to give them skin in the game. They would consume their healthcare wisely, and they would have the same freedom to choose a doctor as they have to go to the store they want and buy the groceries their family prefers. That's the way to start.
And copays and deductibles. Dr. Siegel, that is an important part because it causes people to exercise some personal responsibility.
They know what they're getting. Before they go to a doctor, they'll say, well, wait a minute, it's going to cost me X copay. Or wait, I haven't met my deductible yet. I'm going to be paying this one out of pocket. Or what about flexible spending accounts, which Obamacare is limiting to $2,500 per person? It should be expanding that. I find that flex spending accounts and health savings accounts work really well because people then know what they're getting. And they'll say to me, why is this thing so expensive? We need uniform pricing. That's another problem. There's so much variability, Governor. You could order a CAT scan in one place, and it costs double what it orders in another.
But first,
in another place.
We've got to put this in the paper shredder. We've got to make, yes, we do. And we have to make 2014 a referendum on the Obama health law. The weasels who wrote this law put all the lollipops up front. But now the pain is rolling out with a vengeance, and smart Americans are going to go to the polls next year and pull the lever for somebody who is going to repeal this law.
Congresswoman, do you sense that your Democratic colleagues are worried about the 2014 elections because they put their names on this piece of legislation?
If they are not worried now, they should be, because the more people find out about it, the more they talk to their insurance provider, they find out what the costs are going up, they find out they're going to have less access, doctors are going to stop practicing, they're going to limit their practices. As Dr. Siegel was saying, what they're saying is, no, this is not what we wanted. We thought we were going to have something that would increase access, give better outcomes, but Governor, give me an example of even one government-run health care program anywhere on the face of the earth that has lowered cost, increased access and provided better outcomes. There is not one. And we want to make certain that we go back to more transparency, that we put patients and doctors in control of their health care.
Baby boomers vote, Governor, and we're seeing 70 million more Medicare patients coming in at a time when Medicare is being cut, Medicare is being gutted, and patients aren't going to be able to get the care they want from Medicare. That's probably the biggest problem right now, and I think that that's going to lead to a change in the election next time.
In the meantime, we really need to help people avoid the landmines. One of them is the loss of privacy, because we all tell our doctors things we wouldn't tell anybody else, right? But now you've got to talk with your doctor, have a serious talk about your doctor keeping 2 sets of books, because your doctor is now going to be penalized if he or she doesn't enter your medical history and your medical treatments in an electronic database. The goal is one national database with every patient having a page.
And I can vouch for the growing pains with that, by the way.
Yeah.
I like electronic medical records, but imagine at a time when they're cutting our fees and asking us to see more patients, we're also having to transition to a paperless system that's got to be integrated and regulated.
And you have to pay for that as the physician.
I have to pay for that, and I get penalized if I don't do it.
On top of all of this expense that Dr. Siegel is talking about, it is a mandate on our doctors, and they're paid less for Medicare and for Medicaid. They're paid less. Their reimbursement rates are less. And because of the way insurance companies are being impacted with new excise taxes and fees, they're having to charge more, and we're seeing it across the board.
Well, when we come back, we're going to take some questions from Facebook, from Twitter, and from our studio audience. Let me just say something to you to keep you in mind. Folks, 10,000 baby boomers a day are retiring and getting into Medicare. Think about the cost. 10,000 baby boomers a day, aging hippies finding out they can get free drugs. That's going to cost a lot of money. And we'll take questions when we come back. Stay with us. All right, in the few minutes we have left, let's go to some of your questions. And the first one comes from a member of our studio audience. Would you tell us your name and your question, please?
Ronit from New York. Is there a provision in ObamaCare that will limit the number of visits that I could see my doctor in a year?
Dr. Siegel?
No, there isn't. And in a way, that's the problem, because if everyone can see their doctor, and I'm not saying there should be something to limit them, but because you can see your doctor whenever you want, with whatever problem you want, my office gets clogged. And my office is so clogged, and they're paying me less and less to see you, I can't necessarily take care of people who are
All
really
right, let's
sick.
go to our next one. Yes, your name and your question, please.
James from New Jersey. Do you think that Governor Christie made the right decision by allowing the federal government to operate the exchange in New Jersey?
Congresswoman, let me let you take that one.
Here is what is happening with the states, and I think that Attorney General Abbott said it well. Once you get into this, you can't get out of it. So our states who are saying, no, we're not going to do a state exchange, are basically saying, look, we know in 3 years, 5 years, 10 years, we can't afford this. That's the smart move. And then to look at the federal government and say, you want it, you can run it. Part of the problem they have right now, and why the cost of the exchanges are quadrupling so quickly, is because more states opted out than opted in. And it's a wise decision on the states, and I think it's caused a lot of people to look at this program and reevaluate it.
All right, let's go to a Facebook question. Carolyn Kirby asked this question: how much is the penalty for not having insurance? Betsy, you want to take that one?
Yes, the first year it's $95 or 1% of your adjusted gross income, whichever is bigger, but that's for every member of your family, not just for the breadwinner in the family. Then it goes up gradually. By 2016, it's $695 or 2.5% of your adjusted gross income, whichever is higher, up to $2,085. But the real penalty is that you lose your medical privacy and you lose your doctor-patient relationship once you're in this government-mandated plan, because even if it says Aetna or Cigna on it, the government's in charge of your care.
Governor, the reason the doctor-patient relationship is in jeopardy is because doctors didn't write this law. Doctors weren't consulted on this law. Lawyers and politicians were the only ones involved.
No wonder it is a mess. There you go. That explains it. Betsy McCoy, Dr. Mark Siegel, Congresswoman Marsha Blackburn, thanks so much. We made one big mistake here. It's obvious. We should have made this a 3-hour special, because we never would be able to get it all covered. Well, join me tomorrow night when Carol Burnett is my guest. And we're going to be talking about her classic show, but also about the death of her 38-year-old daughter, Carrie. Carrie had battled drug problems and overcome them. But then Carol explains the tough choice she had to make to help her daughter.
So she was about 16 or 17 when finally the penny dropped. And I realized I'm not going to be her best friend and make her love me, because she didn't love me anyway. You know, the disease in her, the demon in her hated me.
She was mad at you.
Oh, yeah. And so what happened was I decided I'm going to love her enough to let her hate me.
Carol Burnett, a beautiful person. You're going to enjoy that. It's tomorrow night, 8 Eastern, on an all-new Huckabee. Well, thanks for watching our very, I think, significant special on Obamacare. Hope we helped you understand a little more. Until next time, from New York, this is Mike Huckabee. Good night, and God bless.